Hi, I'm Sanjai Addla. I'm a urologist, Uro oncologist and a robotic surgeon at Apollo Cancer Institute, Apollo Hospital, Jubilee Hills. Today we are going to talk about common diseases that affect urinary tract. If you look at the commonest problem that affect this, you can probably categorize them into three. The commonest problem in India is a problem of urinary stones. The second problem is prostate enlargement causing the problems. And the third, especially in women, is problem with urinary leakage. So answering the first question regarding the urinary stone formation, the symptoms are related to where the urinary stone is. So if it is in the kidney, patient would complain of pain in the kidney area, renal area or loin area. If it is in the lower part, which is the ureta, which is the tube connecting the kidney to the bladder, the pain will be lower down in the abdomen, in the front of the abdomen. And then if it is more closer to the urinary bladder, then the symptoms will be more in the lowermost part of the abdomen or in the groin area. Normally these are treated depending on where the stones are and depending on the size of them. They can be treated either by medical treatment so that we can help the stones to pass, or if they don't pass in the specified time period, normally at around 2 to 3 weeks time, they can be dealt with surgery. In that situation, if we are going down the line of surgery, they can be dealt with laser or shock waves from outside, or in very rare situations, we might need to do a keyhole surgery, putting a telescope into the kidney. So these are problems that are related to urinary stones. The second problem with respect to urinary tract is enlargement of the prostate. So if you take anybody, especially a 60-year-old with gray hair, bald person, they do tend to have an enlargement of the prostate in around 60% of the cases, and that tends to cause the problem. And the problem is mainly with respect to the flow of the urine. So the patient would complain of going to the toilet frequently, needing to strain to pass urine, stopping and starting when they are passing urine, and waking up during night time to pass urine. And even after they have emptied their bladder, they feel that there is still something inside that needs to come out. And these are the typical symptoms associated with an enlargement of the prostate causing blockage to the urinary tract, thereby causing the symptoms. Again, what are the treatment measures? Treatment measures are again medical if they are mild symptoms, or surgical in the form of making the channel through the prostate better when there is an obstruction to the urinary tract. And the third commonest problem is of urinary leakage, whether you call it as urge urinary leakage, in that the patient, especially women, are going to the toilet frequently, about 10 times during the daytime, or in the night time, and then they are leaking before they make it to the toilet. That is called as urge urinary incontinence. And the second one, especially in patients who have, or women who have given birth by normal delivery, they tend to have stress urinary incontinence, in that when they are straining either to lift up anything heavy or lifting up the baby, or when they are walking, they tend to leak a small amount of urine. That's called as a stress urinary incontinence. The primary problem in the urge urinary incontinence is dealt by medication. Rarely do we do surgery in that situation, whereas the stress urinary incontinence, the initial step is of teaching the patient physiotherapy, and if that doesn't work, they will need an operation to support the urinary tract better, called as a colposuspension or a sling. That's what is done for stress urinary incontinence.